again, everyone. Thank you. If you can't hear me in the back, just like, I don't know, do a raise your voice, but I will try my best to project. My goal today in sharing our story with you again is to be able to show you the way, even though I'm sure you have already seen it from Adrian's presentation, clear as day. But I'm going to show you through a perspective of one story, the way that trauma shows up for both patients and providers, and what makes it tricky when that shows up at the same time for the same event, but in quite different ways. And so as I'm going through my story, if it feels tolerable, I would recommend just considering what it's like to be the team in this scenario. Maybe you have had a scenario where you have been a part of the team in a similar scenario. So again, only if it's tolerable, just consider what it would be like to be here in this day. So this is my very pregnant self. My pregnancy was very normal. I was healthy. I'm gonna move that out of everyone's way. It was very exciting. It was the first grandchild on both sides. So as you can imagine, lots of excitement, lots of joy. I did not have any complications, except I did feel like I had a very large baby. This was still a month before I delivered, but he was measuring right on track. He was measuring right on track. Everything was fine. And at 40 weeks and 2 days, I went in for just a typical appointment. And I will share the caveat with you that I have no memory of the rest of the story that I will tell you. I have a 10-day gap in my memory, and so I do not remember going in for this appointment. My last memory is, this was a Monday, my last memory is from the Friday before, when I was getting my nails done, actually. So I went into that office, and this has been put together through medical records, of course, so 6,000 pages of medical records, my husband's perspective, my family's perspective, and my medical team's perspective. They've all been generous enough to trudge through their own trauma in order for me to try to heal mine. So when I went in for this appointment, I had a high blood pressure reading at the beginning of the appointment and a high blood pressure reading at the end of the appointment. I was past due. I was sent to triage. And at triage, I made an informed decision with the OB that was on call to move forward with an induction of labor based on the gestational hypertension and my concerns about how large my baby was. Is that working now? Oh, I probably have to press back because you press it off. Oh, no, you're good. So this is me looking very excited, but not excited for my induction process. I won't bore you with the very typical first-time mom induction. Cervical overnight, Cook's catheter the next morning, Pitocin, quickly followed by an epidural. And that night, my membranes were ruptured. It was a long and slow process. According to text messages, it was very uncomfortable. I should have gotten the epidural before the catheter was placed. But all in all, it was moving along exactly as it should have at that point. The next morning when I woke up, so this would be 2 days after the induction started, I was finally 7 centimeters. And then by midday that day, I was finally 10. My OB came in. She said, "You're 10 centimeters, get excited, get ready to meet your baby." At that point, she left the room and got ready for the delivery. She, again, imagined it would be a longer and slower pushing process. My baby was also OP. And so she left the room. My mom actually also left the room. My mom was in the room with me and my husband, and we had decided, again, I have no memory of this, but we had decided she was going to be in on the delivery with us. I think my husband was struggling and needed some of his own support after a 2-day induction, and we wanted her to be in on the delivery. So she left excitedly to go tell my dad, who was in the waiting room, that she was going to get to be in on the delivery of the baby. When that happened, it was my nurse and my husband in the room. I turned to my nurse and I said, "I'm not feeling well." And she said, "Okay, that is normal for transition," because I was feeling nauseous. "I'm going to get you a bag to be sick in." And I said, "Nope, something is very wrong." And when I said that, she glanced over at the monitors. And as she glanced over, I started screaming that something was wrong with my heart. And seconds later, I went into cardiopulmonary arrest. My nurse acted very quickly. A code blue was called. People came rushing into that room. My husband describes it as a zombie apocalypse. We were lucky enough that for some reason, there was a critical care conference on the L&D floor that day. So everyone from critical care was right where they needed to be. They got into that room, they decided to take me to the OR very quickly. We thankfully have an L&D OR, which was right across the hall. And they were able to deliver my beautiful chunky son here within 6 minutes of that code blue call, which without a doubt saved his life and of course played a role in saving mine. He was born unresponsive. My OB will tell you that it was the heaviest baby she has ever delivered because he was 10-14, so I was correct. And also unfortunately, because he was unresponsive, he had no muscle tone, making him much heavier. The NICU team worked on him and he did incredibly. Within a few minutes, he was able to be resuscitated, and anyone who was in the OR that day will tell you that when they heard my son crying, they all cheered. And so while it was a devastating event for a lot of reasons, and the way he came into this world was devastating, I kind of view that as his little celebration into this world. So they whisked him away. CPR had continued towards the end of my C-section. My OB will talk about how difficult it is to sew someone up from a C-section while compressions are happening. So they would have to continue to pause each time so she could throw a stitch and then continue compressions. They did achieve ROSC by the end of the C-section. So it was about 10 to 12 minutes that I was down for. And once they did that, my OB recognized likely I was having an amniotic fluid embolism. Doing a quick differential in her head, she was able to recognize likely this was an AFE. And so she prophylactically placed a Bakri balloon in my uterus and made the call for MTP, knowing that DIC was likely right around the corner. As you can see, I went into fluoride DIC. I had profound DIC. There was 5 liters of blood collected through the Bakri alone in the first hour. By the end of this ordeal, I needed 140 units of blood products. So I had lots of lines and chest tubes placed. Unfortunately, while they were placing lines, there was air aspirated, so chest tubes needed to be placed. But my team began to try to stabilize me, and they recognized that my heart and lungs were not recovering. And they knew that they would need to do something drastic if I was going to survive this. And so they do not have ECMO at their hospital. They are a level 2 trauma, but still a small community hospital. So they called over to Lincoln Hall Medical Center to get ECMO transported in. They had to transport ECMO and the entire ECMO team in because I wasn't stable enough to put lines in and transfer. So as they were calling for ECMO to come in, due to the blood loss, I unfortunately went into cardiac arrest again. And at this point, the mood in the OR, you'll hear my OB talk about this actually in a quick video that I have, was that I wasn't going to survive this event. There were other OBs in the OR that tried to prepare my OB for the fact that I wouldn't make it. And she actually left the OR during that arrest. There was lots and lots of people helping to talk to my family. And she let my family know that there was a lot of bleeding and they were having trouble stopping it and that she needed them to pray. And then she left and went back into the OR, and thankfully they were able to achieve ROSC again. I was brought back after another few minutes again, and ECMO was brought in. These are blood gases from the second cardiac arrest, which show just how sick I was. And once I was cannulated for VA ECMO, the bleeding was then, of course, the main concern because I was technically hemodynamically stabilized on ECMO. So they took me down to interventional radiology because I wasn't stable enough to open up in the OR at that point. They took me down to IR. They attempted a uterine artery embolization. And unfortunately, that only partially worked. And so they went and at that point had stabilized the bleeding enough to take me back to the main OR for an XLAP. And what ended up being a hysterectomy and a right salpingo oophorectomy. There was about 6 liters of blood and clot in my abdomen when they opened me up. So they really had no other choice at that. While this was happening, my husband got the chance to meet my son for the first time. This was very difficult for him because he didn't want to leave where he could be closest to the OR that I was in. So they were like in a conference room near the OR. And he was told by my family, I have to see the baby. And he's like, I can't leave Kaylee. And so eventually they were like, okay, well, someone has to go see the baby. So we're gonna go. And then he was like, no, I will be the first one to see that baby. So he met our son Callahan 4 hours after he was born in the NICU. And we have some pictures and videos of that. So once I was stabilized on ECMO, they had left me open from the XLAP and just kind of packed it with quick clot combat gauze, knowing that they would need to go back in several more times. They were able to get me transferred to Lincoln Medical Center to maintain the ECMO circuit. My family was able to see me before I left. So they were able to stop me kind of in the hallway on the way, and they were able to tell me like that Callahan was beautiful and he was perfect and I had done such a good job and that they just needed me to keep fighting. Once I got to Lincoln, the issue was my heart. Again, ECMO was keeping me oxygenated and perfused, but my heart was not pumping effectively, and they had done all of the medication trials, the typical obinamine, epi, et cetera. Everything was making me tachycardic, but not changing my pulsatility. So my interventional cardiologist told my family that their last ditch effort was to try to place an Impella, which I'm sure most people are familiar with, but is a small heart pump that was put in up through my femoral artery into my left ventricle to offload and give my heart time to rest and hopefully recover. So this is me on ECMO with the Impella in, and that morning I had another XLAP and washout, and that night Callahan was transferred. And my team, talk about trauma-informed care, my CTICU nurses, that entire team worked so hard to make sure that they could get my son into the CTICU and skin to skin while I was still intubated and on ECMO. And so I am forever grateful that they made that happen. I think it played a huge part in my recovery, next to, of course, all of the incredible medical interventions and medical personnel. Very quickly because of whatever monitor that was going off. But they kept bringing him down each time. Honestly, they had to really convince my husband. He was like, you are not going to bring an 11-pound baby and put it on her chest while she's on life support. And they were like, we won't do it without your consent, but we really are going to do it because the baby needs it, but more importantly, Kaylee needs it. She needs to remember that there is a baby that was delivered and that she has so much to fight for. Day 5, I had third XLAP and washout, and the Impella had worked so well within the 24 hours that it was in, that they took me back to the OR to downgrade me from VA to VB ECMO. And when they clamped off the lines, they were actually able to completely take me off of ECMO and Impella support at that time. So about 2.5 days after my amniotic fluid embolism, I was off of ECMO. And then, of course, nothing can go without issues. So there was like a right chest tube placed for some pleural effusion or something. But regardless, it was all in all looking to improve in a way that no one had really expected at that point. And then that's our first family picture together. I like that picture. On day 6, I had my 4th and final XLAP and washout and was closed at that point. And this is a picture of my best friend, who's actually an epidemiologist in maternal health for the CDC. And they were trying to get me extubated as quickly as possible. My team was very aggressive in trying to get me off of every support. The problem was I was waking up agitated and freaking out. As you can imagine, I didn't know what happened. I didn't have any memory of giving birth. And I would panic too much and they'd have to sedate me again. So my best friend at this time was like, we're not doing this. We're not doing the back and forth. Like, she's getting off the vent and we're doing it tonight. And so she stood over my bed like this for the 40 minutes and did mindfulness with me so that I could be calm enough to be extubated. And that is exactly what happened that night. I was able to be extubated after that breathing test. And then on day 7 and 8, I was able to meet my son for the first time. I do not remember it, unfortunately, but we have lots of beautiful videos and pictures of that event. And I pulled this from my chart, because I just really appreciate that that cardiologist recognized my remarkable recovery enough to put it in my chart. And then on day 8 was when I have my first memory. And that memory is really important for today, because the memory is my OB standing on one side of my bed and my anesthesiologist standing on the other from my code at Paoli. And they held my hands and they took me through everything that happened with such empathy and such compassion. And it is something that I will never forget for the rest of my life. And that changed the process of how I recovered from all of the trauma that I experienced. And I'll talk a little bit more about that when I talk about provider trauma. Transferred from the CTICU down to the ICU about a week after my AFE. They had kept my epidural in, which is interesting, because they knew my abdomen would be in pain. And so I could just actually continue to click the little epidural button when I woke up. But that was removed at this point, and the only thing keeping me hospitalized was my white blood cell count. This is just a quick video. Let's see if it plays. That's all I've ever wanted to hear. There was a lot of struggle with insomnia and anxiety. I like to say the ICU is a fantastic place to have your life saved. It is a very difficult place to be aware and awake in. And I was very, very much experiencing this at that time. This is just me finally outside. Again, my team, amazing trauma-informed care. They were getting me outside. They had my husband bring my dog to the courtyard so that I could see my dog, because I hadn't seen him in a while. And I was seeing my son daily. Exactly 14 days from the amniotic fluid embolism, I was discharged straight from the ICU to home on Tylenol and Eliquis. For a lot of people, this is my son's 4th birthday. He's actually 5 now, so this is a year ago. But for a lot of people, this is where our story ends, right? We got the happy ending, we got the miracle, and I will celebrate that every day for the rest of my life. The fact that I get to be here and watch my son grow up is a feeling that I cannot actually describe without crying, so I'm gonna pause. But the story didn't end for us there, and it didn't end for my team there either. The positive outcome, while amazing and beautiful, didn't erase the trauma that everyone experienced that day. I'm not really gonna go through my trauma because I think it's really obvious, and I do wanna delineate, of course, that this is just one example. This is a very severe example. We see a wide range of birth and perinatal trauma. Waking up intubated in the CTICU, having no idea what happened to me, to the point where my brain had decided that we had been in a car accident, because my brain couldn't, why else would I be in an ICU setting? I didn't remember going in for an induction. So I thought we had been in a car accident, and unfortunately, at that time, my husband was not in the room. And my mom showed me a picture of my son, but he had all of those wires on him. And so I just decided in my brain that we had been in a car accident and my husband and son had died in that car accident. Again, thankfully that was quickly rectified, but this is what can happen in the ICU, and why trauma-informed care in the patient side is, of course, what we've been talking about for years and years. So my team's trauma, and what I really want to focus on for the end part of this presentation, is really apparent in this case. This was a community hospital. Like I said, they were a level 2 trauma. I don't think I would have survived without a trauma team available and lots of blood product. So I'm very grateful for that. But they were still a small community hospital. Adrian, you hit the nail on the head when you were talking about the peer-to-peer support, and when you were talking about an event that shakes an entire hospital. That is what happened at Paoli. I will still hear stories to this day of someone who was on the med-surg floor and heard the code blue for maternity and stopped what they were doing and prayed. I hear from patients who were on the floor that day, who were literally giving birth and asking their nurse in between contractions if the person was okay that the code blue was called for. There were techs holding doors to make sure that whenever my bed needed to come through to go to the OR or IR, that it was open and available. Everyone in that hospital came together to save our lives that day, and were also deeply, deeply impacted by what they saw and what happened, particularly the team that was in the OR that day. My hospital had never seen an amniotic fluid embolism. This was their first. So just a quick props to them for doing such an incredible job. I am still very close with my care team. My nurses, my OB, my trauma surgeon, my cardiologist will still come to Cal's birthday every year. And so I know some of the intimate details of their experience of this day. I'm gonna share two with you. One from my charge nurse, and then I'm gonna show you a little video of my OBGYN. But my charge nurse, she didn't tell me this until a few years later. She was in the OR during the second cardiac arrest. And I had mentioned my last memory is getting my nails painted. I got them painted bright pink because I wanted joy and wonderfulness for my baby to come into this world. And she said, Haley, I remember standing there watching them do CPR. And I remember looking at your nails and thinking, I'm gonna go to this girl's funeral. And that moment has stuck with her. It will stick with her for the rest of her life. The positive outcome that we had doesn't change the trauma of that moment for her. It's not how our nervous system works with trauma. It would be amazing if every positive outcome then erased all trauma that we experienced, right? No one would ever really be traumatized except for the cases of mortality. That's just not what happens. And so to see that story, that's seemingly small piece of that story carried with her, just one example of the 50 or 60 people who were in the OR that day. And then, so I run a podcast and my OB is just a beautifully generous woman, came on and was vulnerable enough to share her feelings and her side of what happened that day. And I'm really grateful for that because I think there's a lot of stigma, as Adrian had mentioned, around being able to show your emotions when something like this happens, to be able to lean into the grief and the trauma of that experience. So I'm just gonna let this do the speaking for me. I will say as a clinician, you can see the trauma and the grief on her face. You can watch her be in the moment and transport back in time because of the trauma experience that she's having in this video. And so that was taken this March. So that's 5 years, almost 5 years after she experienced this event. And what I want to bring up about that is two things as I'm running out of time. My hospital actually did a fantastic job. There were things I could have done better, but did a fantastic job supporting those providers who were a part of that experience. Even with that positive outcome, the first thing that they did wasn't a debrief about how the care was provided. It was a debrief emotionally for the staff to get together in a room and cry, essentially, is what happened, to cry and share their experience of that event. And I have no doubt in my mind that that is what allowed my OB and anesthesiologist to show up in my room with such empathy and compassion a week later. But when we are able to acknowledge and support provider trauma, it leads to us being able to provide the best possible patient care. I say this all the time. Providers who are traumatized are going to have a very difficult time providing trauma-informed care to patients because it's activating for them. For them to acknowledge the trauma that their patient experienced, they have to acknowledge, if they experience trauma, they have to acknowledge that trauma too. And sometimes that feels too hard if they're not supported in that. They don't have the psychological safety to be able to do that. I'm just talking a little bit about obstetrics specifically. Adrian really covered this, but I do always like to say, I think there's a uniqueness to obstetrics in terms of the chronic stress we are asking providers and nurses to go into one room and grieve with a patient who is experiencing a stillbirth and then walk down the hall the next minute and celebrate the first birth of someone's baby. That takes a toll, right? We have to recognize that and have the spaces to create awareness and support around that. Okay, this is where I live, at this intersection between patient and provider trauma. We just went through talking so much about how providers and nurses are traumatized. And when they're not supported, when they don't have great awareness, when there aren't policies in place to be able to debrief, they will turn to compartmentalization. I have a lot of clients who are physicians and nurses. I have never seen people compartmentalize like the medical field. Sometimes it has to happen, right? Like I'm not knocking compartmentalization. We all use it. It is a skill. And when we turn to that, that's where we see the avoidance of their own trauma, right? And when you get the avoidance of your own trauma, they're going to likely focus on this whole event as a win. Because in a sense it is. I survived, my son survived, and we survived cognitively intact. You can't get a better outcome in an amniotic fluid embolism than that. And there is pain and there is trauma associated with it. And so we have providers who, when they're not adequately supported, will focus on that win, which turns into meeting patients who are devastated with just be grateful. We saved you. You're lucky to be alive. Because all of that doesn't come from a place of malice. It comes from a place of avoiding one's own trauma because it's just too painful or there's no place for it. So this juxtaposition is where I live because I know if we treat and support providers and nurses who experience trauma, we are going to prevent so much perinatal trauma. It is going upstream and helping the person upstream, right? To create a situation where we're not constantly in my therapy office downstream trying to support patients who have been traumatized. Honestly, I'm going to skip this because everyone's talking about this today. And basically, I found what Adrian found. When we look at trauma-informed care for patients, that's actually just what we need to provide as an organization for care teams. And untreated, unacknowledged provider trauma can cause harm, and I have seen it cause harm. If a provider goes into a room where they're activated because of a past event, a patient has gone into cardiac arrest because of whatever it is, and that new patient, for some reason, activates their nervous system to have a response to that, they're going to treat that patient differently than they would. And that is not, again, malintent, that's just how trauma works. Okay, I made it to the end. I think it's exactly 12:15. Yes, crushed it. Okay, so I also do work. I do all the support work for the Amniotic Fluid Embolism Foundation. And Miranda Clausen, who is the executive director, and I have created these wonderful effective communication guides. There are lots of guides out there for delivering bad news, as Adrian talked about, but not really any of them take into account the fact that the person who's delivering the news could be traumatized. And so our guides take into account the provider trauma, the nurse trauma, and make it very, very simple and easy to follow, because what we know about trauma is that your executive functioning is impacted in those moments. Your ability to communicate is actually impacted. And so we take that into account with these guides that we've created. They're not just for AFE. They're for severe maternal events in general. So you can use them for any of that. There's also things that you can hand to patients that help them understand what happened to them. You can change anything. It's all free to download. You just go to this website. And that's all I have.
And I'm gonna give 2 plugs.
Okay.
Haley and
Thank you.
Another one, you have the QR code
Yes.
in your thing.
In
So
your
you can take this to your units and hang it up so your teams can also get this resource. Number 2, Miranda from the AFE Foundation is going to be giving a presentation on AFE and
Pathophys probably.
all that kind of stuff for the Maryland Patient Safety Center January. So if you are
Don't
a
miss it.
member
She's
of the
amazing.
Maryland Patient Center, free to you. She will be presenting on more on that. I'm sure she'll talk about this again. And hopefully coming to a PubMed near you, Kaylee and Miranda are writing an article on effective communication and the importance of effective communication after patient trauma. So that is all coming as resources, but we did give you them so that you have it. So thank you so much, Kaylee.
Yes, thank you all so much. Thank you.